Good morning, ladies and gentlemen, dear Professor Fischer, dear Dr. Habrecht, dear Mr. Burkhardt, ladies and gentlemen, dear colleagues from Hans Seidel Foundation. With a warm welcome, I would like to welcome you to our second Talking Asia Politics series, organized by all our colleagues, what I would say, who have an Asian connection. This means our colleagues from the South and Southeast, East Asia, and from the Northeast and Central Asia desk within the Institute for International Cooperation of Hans Seidel Foundation. My name is Susanne Luther. I am the director of the Institute for International Cooperation of Hans Seidel Foundation, which means being in charge for all our projects of international cooperation with around about over 50 countries on the African and on the Asian continent, as well as in Latin America. In all our projects, we focus on such important issues as democracy building, rule of law, good governance, or helping people manage the difficulties of climate change. We partner with local organizations from civil society, but also with institutions, with officials, and with the academic world. Our today's focus, of course, is Asia, so let us turn to Asia now. Asia is the world's largest and most populous continent. Its geostrategic importance for the EU can be seen by the fact that the EU not only has 4 bilateral strategic partnerships within the region, with China, with Japan, with India and South Korea, but that it has also signed a strategic partnership with ASEAN in December 2020 and has only recently published the new Indo-Pacific strategy. Asia not only plays a vital role for our economic future, it is also and must be a strong partner if we want to face the important challenges of our time successfully altogether. Not only the current pandemic, but also other global threats, such as the mentioned climate change, such as terrorism or cyber attacks, do not stop at country borders and cannot be overcome by closing borders and focusing on narrow national interests only in these times. So with this new series, Talking Asia Politics, we intend to discuss political and also social developments in Asia, to point out risks and opportunities for the countries and to consider their consequences for Europe. In our analysis, we always include opinions from within the region as well from outside, and we focus on a constructive dialogue, allowing different points of view to coexist and to be discussed. In 2020, the coronavirus spread rapidly around our interconnected world, and quickly almost every country worldwide has so far reported cases. However, although the virus caused the same disease in each country with severe consequences, there were of course vast differences in how each country reacted, which countermeasures were taken, how the virus spread through society, and deriving from all this, very likely also in what its long-term consequences will be for the countries and for us all together. Therefore, we decided to take an in-depth look at the situation in 8 different countries in Asia. We have asked experts who have followed the spread and the consequences of COVID-19 to analyze success and failure of different strategies and to point out potential short, medium and long-term consequences of the virus in the region. Finally, we will have one expert of EU-Asia relations who will point out the consequences for our future and our cooperation in and within Asia. With today's series, we will have altogether 9 online seminars in the next several months to come, where our experts will present their insights, and each paper will be available for download. You saw the timetable that we published before starting this session today. And after that, in the second half of this year, we will publish a special edition of our publication AMEZ, where all 9 contributions then can be combined for an interesting reading. Today we will start this series by taking a close look at China. And so I'm very happy to introduce and to welcome our speaker, Professor Doris Fischer, to you. Professor Fischer is the Vice President of Würzburg University and the Chair for China Business and Economics at Würzburg University. She's an economist and a sinologist with over 30 years of experience in academic research, teaching, and consultancy on China's economy. Doris Fischer has done extensive research on competition, regulation, and industrial policies in various sectors, focusing, amongst others, on the rationale of Chinese economic policies and resulting incentive structures of economic actors. So a very, very interesting expert to talk to about the recent developments going on in China in this special pandemic situation, and talking about all the consequences for the economy in China, but also worldwide. With this in mind, I would like to wish us all a very interesting discussion this morning, at least this morning here in Germany. And I would like now to hand over to Dr. Habrecht, our head of the Northeast and Central Asia Division, whom I would like to thank very much for taking over the moderation here today and who will now be your host. Thank you very much for your interest.
Thank you, Dr. Luther, and welcome to the audience also from my side. Before I hand over to our speaker, Professor Fischer, I would just like to give a very short technical briefing. So the most important tool for today is our Q&A box. You can see it on the bottom of your screen, and there you can ask any questions in relation to China and the pandemic, and we will do our best today to answer all of them within the next hour. If you encounter any technical difficulties, you can also use the chat function, which puts you in touch directly with our organizational team behind the scenes. And we have some very experienced troubleshooters there who are willing to assist you with anything that you encounter during the seminar. Finally, we are recording this seminar and we might be publishing it on our websites or other social media channels. As Dr. Luther already mentioned, this is the first part of a longer series of altogether 9 seminars where experts of different Asian countries analyze the consequences of the pandemic in the respective countries. And each seminar is accompanied by a more in-depth written analysis, which will be available for download. And today's feature paper written by Professor Fischer will have a special service. We will send it to everybody who signed up directly after the seminar. So we start our series with China, and China portrays itself as a very successful example when it comes to the containment of COVID-19. And the official numbers as well as the newest economic data seem to prove China right. However, in Europe, many people ask, are these numbers reliable? And also a lot of people do feel a bit uneasy when they think about the strict lockdowns in China and also surveillance technique that China used in order to contain the virus. So China is one of the countries where I think many people feel like they actually know a lot about how the virus spread and which strategies the government employed, because it is so prominently featured in the media. But at the same time, I would say it is one of the countries where we actually know very little about the situation on the ground, because all the information we are getting is filtered by different interests. And with this, I would like to hand over to Professor Fischer, who is one of the most renowned China experts in Germany. So please, Doris, tell us which challenges posed COVID-19 to China and what are the mid and long-term consequences according to your assessment?
Thank you, Isabel, and thank you, Dr. Luther, for the kind introduction. Maybe I start with a very recent experience. This morning, before this talk, actually, I was on a meeting with leadership of one of the famous Chinese universities, And the team in China sat together in a rather small room, crowded around a microphone, so to speak, a conference room microphone, without keeping distance, without masks, and they felt very comfortable. Whereas the German side had several partners in the conversation who all were separately kind of connected through their home office online or internet connection. So another anecdote, maybe just recently, a representative of a German organization, in order to tease me, said when we had a talk, said, well, you know, I'm sorry to tell you, but over the past 7 days, I have been eating out in restaurants, in different restaurants, even every evening. And I was kind of tempted to say, shut up, you know, I don't want to listen to that. So as Isabel mentioned in the beginning, the success of China's containment of the virus so far is real. We should not expect that there is, see that everything is kind of a lie. This is not the case. What I'm going to do now is to give you a short introduction, a short backward looking, so to say, how this all unfolded in China. Then I will go systematically through, well, probably not all measures taken to contain the virus, but different types of measures taken. And then I will expand to the economic and social impact more in detail. And I will end with some ideas about geopolitical and geoeconomic impact in the longer run. And I hope I managed to do all this in the time that I've been given. Okay, so the virus unfolded in China at the end of 2019 when news emerged about an unknown virus spreading in Wuhan. In less than 2 months, then it became obvious that the virus would expand globally. And ever since, the world has been struggling to limit the pandemic and its impact on societies, economies, and politics around the globe. Meanwhile, China has been able to contain the pandemic, turning China in an island-like fortress, difficult to visit, but rather safe within its borders. Much of the media coverage regarding China's role in the past has been about the question of the origin of the virus, the official communication strategy in early weeks of the crisis, as well as China's well, mask and vaccine diplomacy, as is usually called. Much less attention has been given to the instruments employed in China to contain the virus, and this will be the focus of my talk. It has already been mentioned that there are concerns whether the data coming from China is accurate. That's one of the reasons why I decided not to use any charts today, because we would then probably end up in a discussion whether those data are all accurate. But there's the 2 examples I just mentioned in the beginning somehow show that the success is real, because a second or third wave has not emerged in China. And if it had, it would have been difficult even for China to hide this. And we have less people on the ground, so to speak, foreigners than before, but we have enough to tell us whether there is, the whole thing would be a scam, so to speak. Nevertheless, there is a bit of insecurity about the data because of the way China counts data. There has been a discussion of whether China really reports infections, so positively tested people or just people who really show symptoms. And I'm not the one to, unfortunately, to really verify what the Chinese do report. I'm pretty sure that there have been numbers that are not fully accurate, but there is hasn't been a large scale second wave or third wave. And the Chinese government in these days try to prevent everything or to prevent the Indian virus variant to enter China and thereby prevent a new surge of infections. Okay, so I will not talk much about the origins of the virus. That is obviously a very difficult thing that the WHO is still trying to figure out where it originally came from. What we do know is that it started spreading, that the alert of the people became aware of it because the virus spread in Wuhan. For whatever reason, it started, our knowing, our knowledge about it started with Wuhan. The government reacted fast, but not fast enough. Let's frame it like that. And so that's probably also because it was in the beginning not publicly acknowledged, at least, that this virus can spread through human to human transmission, and then also only later people acknowledged that it can spread without people showing symptoms, which made it very difficult for the Chinese government in the beginning to react, arguably also, and still also difficult for other countries to react properly. So what the Chinese government did, they reported to the WHO in January 11 that there is human-to-human transmission, and they realized that the issue is really severe somewhere in the second half of January. Unfortunately, after some larger festivities had been taking place in Wuhan in preparation of the Spring Festival, and that led to the fact that the virus could spread both in China and unfortunately also internationally, because the international airport was only closed on the 20th of January. And that was too late to prevent the virus from moving abroad. Shortly after this lockdown, there's a closure of the airport and the train stations, and also the highways from Wuhan, also the province Hubei, which is encircling, so to speak, Wuhan, or which Wuhan is the capital of, was sent into lockdown. And soon afterwards, a lot of other areas in China practically also went into a lockdown because the government decided to extend the Spring Festival holidays. For those of you who are not familiar with China, usually around Spring Festival, I wouldn't say that China is in a lockdown-like situation, that would be wrong, but at least many companies, many shops close, others open because people also go out shopping and traveling, but many people go home and are not at the place where they work. And by extending the holidays, the government basically decided to extend the production stop in many factories. For most of the places in China, this lockdown lasted until sometime in March. It depended on the pandemic situation in the different areas. Wuhan and Hubei only emerged from the lockdown, which was a very severe one, in early April after 76 days. And the way that this was counted shows you how difficult to stand the situation was for the local people. Today, the official number of total infections in China stands around 100,000. Again, this is probably the number for those who have been tested positive and defined as somehow having the illness, and not just everybody who has positive symptoms. The accumulated death toll is below 10,000. Which is, if you compare it with our today's number, is something beyond, we are already beyond 80,000 deaths in Germany. And just as a reminder, Germany has about the size of a province in China, both in terms of regional spread and population. So China today is among the countries with low infection rates and a low aggregate number of coronavirus deaths. There are occasionally cases of infections reported. Most of these are from people coming into China from abroad. And I will get back to that later. If the Chinese government had initially been reluctant to communicate the danger of the virus, it changed its approach dramatically in late January. And when Party Secretary Xi Jinping himself declared that the country was at war with the virus and would do everything to eradicate it. It was called then a fight, the fight was called like a people's war, and the target was to suppress the virus by all means instead of finding a way to live with it, which arguably has been the strategy in Europe. Formally, the draconian measures taken to fight the pandemic could be based on the existing law on the prevention and control of infectious diseases and regulations applying to sudden public health emergencies. While these rules served as the initial playbook for the fight, implementation has become more refined over time. Not least because the fact that the virus can be transmitted without people showing symptoms, that was something that also arguably was new for the Chinese strategies. The measures taken by the government to fight the virus can be divided into 4 categories. First, hygiene rules. Second, measures of testing, tracing, and isolation and related precautionary measures to prevent the transmission of infections. Third, measures added during a lockdown to suppress the pandemic. And fourth, measures to defend China against the import of infections. The central government plays an important role in defining the strategy and coordinating efforts, which, for example, included the mobilization of the military support for Wuhan under the lockdown in the first quarter of last year. Regardless, the central government's war rhetoric attached to the fight against the virus, the measures taken are often defined locally. This is quite important. On the other hand, while the localities are those who define with the local measures, as a central government's shadow of hierarchy, as we sometimes call it, so the shadow of the government is always in place, not least because the government last year at some point decided to oust the Wuhan decision makers who were seen to be responsible for the early delay in the communication. Okay, let me shortly go through the different measures taken. Hygiene rules. The general hygiene rules in China do not differ much from those recommended in other countries. At the individual's level, hand disinfection and distance keeping form part of the rules, as does the wearing of masks in public. Regarding the latter, China profited from a high level of acceptance from the start. I remember, and I think that's probably, I don't know, Isabel Habricht has probably the same experience, that China researchers in the first months of 2020 were desperate to explain to Germans that wearing masks is not something like a superstition in Asia, but is based on both experience with the SARS pandemic in 2003, and also with an attitude that, well, in case of doubt, you wear a mask in order to protect the others. So you see mask or experience mask wearing in China, in Japan, and so on, even in times when there is no pandemic, just because people who have any symptoms of a cold or so prefer to wear the mask, are sometimes also expected to do this out of respect for the others in order to prevent contagion. And so this was the discussion we experienced in Europe, especially in Germany, in the, let's say, February, March, April of last year, whether masks make sense or not. That is something that never really played a role in China. And so this was very helpful, I think, both during the time of the lockdown, but also in the months that followed. And if you see photos today from China, you will see that even though I just mentioned that in those meetings, they do not necessarily wear masks, public street photos show still a lot of people wearing masks just out of cautiousness, I would say, not because it's necessarily prescribed. Well, the second block of measures that were taken, I would call test, trace, isolate. We are familiar with these keywords, but the approach of China has arguably been a bit more strict than in our place. Because once that the specific feature of the COVID-19 virus became obvious, the Chinese government started to build up large-scale testing capacities. Soon, mass testing became an important instrument whenever a cluster of local infections was detected. One of the first mass testing initiatives was actually organized in Wuhan, not immediately, not at the beginning, I mean the lockdown, but later, and it aimed to identify and isolate all those who had an active infection. Similar mass testing campaigns were, for example, undertaken after a super spreader event last year in summer in Kashgar, in Xinjiang, and as well as after local outbreaks in other municipalities and also specific districts in Beijing. So whenever the government detects that there is a larger number of infections, and especially if there is the suspicion that these are locally transmitted infections and not imported ones, they organize these large testing initiatives. The detection of such infections and clusters often emerge from routine testings at workplaces, airports, and train stations, and also at community entry checkpoints, which are still in place not everywhere, but are not completely, as far as I know, they are still there. We have a bit of a problem to assess how much every of these measures is really in place in every place in China, because, as you know, China is a continent. There's a lot of regional variety. Local governments decide what to do. Local dunways or units may decide. So we know that these community checkpoints were an important instrument whenever there is a local infection event, so to speak, but I would not be able to guarantee that they are always everywhere in place. But if someone is tested positive, and that is, I think, important, they're immediately isolated and their itinerary and contacts are traced. Even single cases are reported in detail in the media. While the infected person's names is not published, usually detailed information is provided regarding the person's whereabouts in the days and hours before the test. This information allows other people to assess whether they might have been in contact with the respective person and may prepare them for changes of their status and code. I explain that in a minute. And such detailed information can only be provided as long as the number of infections are low and tracing is still possible. And this has been the case in China since the lockdown ended in Wuhan and Hubei. So this is a very important part. Maybe you have heard that, I mean, that's a different regime, but in these last 2 days, Taiwan has increased surveillance or test, trace, and isolate rules again, because they have something like, in whole Taiwan, less than 40 cases. I mean, something that, I mean, whole Taiwan, yeah, again, like a state of Germany. We are talking about thousands of infections daily currently, and they talk about 40 or so overall. And the same is the case in China, where you have even more people. Single-digit, double-digit infection numbers create a huge reaction in order to, as I said at the beginning, to make sure that this virus never really expands in a way that you cannot control it and cannot trace it. Testing activities are not limited to corona tests in the narrow sense as we know it. A specific instrument in the Chinese approach has been the use of public fever screening. At train stations, hospitals, roadside and community checkpoints, thermometer guns, as they are called, are pointed to a person's forehead for an infrared-based temperature check. People with a temperature above normal levels would nevertheless would be isolated, even though it is, I mean, even though it's at that point not sure that they have coronavirus, but they would immediately be isolated. Whether temperature screening has been an effective instrument in the fight against COVID-19 pandemic is unclear, even though China overall has been successful. The thermometer guns have been criticized for the low level of accuracy. Especially contagious persons without symptoms can hardly be identified with these methods, but the screening is probably one of the measures to demonstrate government action and to constantly remind Chinese people of the virus danger. So both, I mean, reminding people, hey, this is an issue, wear your mask, be careful, but also to show how the government, government does something. And people, as I said, with an unusual temperature would also be isolated as a precautionary measure, even if this is not their temperature. I mean, it could be a normal cold or whatever. As in other countries, tracing is partly based on interviews with infected persons to identify past contacts. Apart from that, however, tracing efforts are supported by digital technology and obligatory smartphone applications. These apps generate green, yellow, or red QR codes depending on the travel itinerary and health data of the smartphone user. So if someone has been in a specific, let's say, district, which emerges as a hub of infections, I mean, again, with very low absolute numbers, then they would receive a yellow code. And if they have been infected themselves, which they have to report anyway, they would have a red code. And then it takes time until, I mean, these persons can slowly but surely emerge from this red code status to a yellow code or a green code. A green code is generated if the user has recently not been in any place associated with an outbreak and is not a close contact to any infected person. How these codes are generated in detail is not fully transparent, but the traffic light system is used to define access to public transport and other facilities for which green code is necessary. Data collected by the QR code checks at community level is aggregated into big data analytics systems with which the government and supporting ICT firms use to estimate the risk of infection within local communities, to identify close contacts of diagnosed persons and to initiate quarantine measures accordingly. Inconveniently, next to a national app of this kind, local governments often demand QR codes based on local tracing applications, thereby forcing travelers to install a variety of apps on their devices. And it can happen, especially as these are accounts by foreigners, that you are for green code for Shanghai and you are from Hangzhou or whatever, and you travel to a neighboring province where this should be in theory accepted, but in practice the locality says, no, we need a green code on, we need you to have our app and our local green code, and then people still have to go to a testing center first and wait until they get a green code for that destination or that place. Isolation rules usually distinguish between coronavirus patients, suspicious cases, and undefined cases and close contact persons. Based on these different status, people are either hospitalized, quarantined in specific observatory isolation wards erected in the vicinity of hospitals, or go direct to hospital. While quarantined, each person's health condition is closely monitored by local health officers, and if people develop symptoms during the observatory isolation, they are immediately forwarded to the hospital, which is nearby. The isolation ends on the condition that repeated tests have been negative. The duration of these measures is defined by local health organization, but needs permission from the next higher government levels for implementation. Usually, the usual time is 14 days, but it depends if you happen, depends on the negative testing too. Isolation at home is the exception and only permitted for vulnerable persons who need special support. So there have been accounts of rather cruel incidences where people have, family members have been separated because some had been tested positive or symptoms, others had just been just contact persons, and then they are sent to different isolation wards, meaning that also occasionally children have been separate from their from their parents and so on. The limited use of isolation at home is based on Wuhan's experiences in early 2020. At the time, it became obvious that many infections were transmitted within families because infected persons had been sent home for isolation at that time because hospitals were overwhelmed. And isolation and dedicated observation centers also reflect a special trait of the Chinese health system, which mostly lacks a system of individual general practitioners. It mostly relies on hospitals to which people turn when with all their health problems. As a result, in the early days of the pandemic in Wuhan, even people with minor or unrelated symptoms would crowd in hospitals' ambulances or ambulance wards. These crowds most likely contributed to the fast increase of infections. And so, whereas we have this idea that, okay, if you have contact to someone who was infected, or if you have mild symptoms of whether contact your local practitioner, that institution does not exist in China. So these isolation wards are partly also an instrument to somehow deal with this specific trait of the Chinese system. And on the other hand, they have been identified as an instrument that helps the limitation to limit the spread. Well, and then there's the third instrument, obviously, is the lockdown as such. There is no international definition or unified understanding of the word lockdown. When we talk here about lockdown, and my Chinese friends hear that we are actually freely moving more or less, they are quite shocked. So I have been contacted by people who are sorry that you can't go out. I said, don't worry, I can go out. I actually do regularly go out and do my exercises outside. And you can, in Germany, and I think this is important to remember, it is easy to have a lockdown where people can go out and you still can you can do endless walks without meeting anybody, more or less, at least not coming close to anybody, closer than 1 or 2 meters, 1 meter feet, 50 and 2 meters. This is not necessarily possible when you're living in a Chinese metropolis. And so the lockdown definition there has been slightly different. The lockdowns in Hubei province and the capital Wuhan were arguably the only locations that, or those were the only ones that were really an extended lockdown, like as I said, 76 days, and also very severe. In that time, the government banned all unauthorized public and private transportation and urged residents to avoid unnecessary transfer in and out of the city. In essence, most residents had to stay within their flats and gated communities. Firms and shops were closed, as were restaurants and kindergarten, schools and universities. Only the most necessary errands were allowed, but even that, usually the households had to define one person for these kind of errands, and it was not like you could decide who's going. It was always, and this was kind of also reported in the communities. Some communities were completely sealed off and relied completely on delivery services, and the delivery services would not enter the compounds and deliver those goods or meals or whatever to the specific flats. They would actually end at the gates of those gated communities where people from the different flats would then pick up their deliveries. And for those people who had to leave their communities, maybe because they had to work, the measures of testing and tracing described before were strictly applied at the community block entry. So before you could, you had to show your codes, you had to do testing and so on. In these cases, at the entry of the community blocks. Nationally, the lockdown was also implemented by a reduction of public and private traffic. So the long distance trains stopped commuting for a while. But overall, the restrictions outside Hubei province on individual mobility were shorter and on average also less severe. Nevertheless, many communities decided to seal themselves off from the rest of the country. So there were a lot of accounts of districts where people were, rural districts also, where people were extremely suspicious of any foreigner, of any stranger from another place coming in. So they would have also road blockages and so on, just to make sure that nobody comes in. That arguably was not an official policy from Beijing, but more local, an expression of local fear, which is in the Chinese countryside a bit easier to implement than in the normal, let's say, German village or small town, because there are overall still less streets in this, as the network of streets in China is and the entrances and exits to many places is, well, the number of these exits and entries are lower. Nevertheless, due to both the extension of the Spring Festival and also a lot of people, specifically public servants and all people who are, let's say, white-collar workers, they mostly stayed at home for, well, an extended period until March. Many of my university colleagues actually had the same experience as we had, at least for the whole summer term, that everything went digital and they were recommended not to leave their homes mostly. So we had at least several weeks in spring last year where probably hundreds of millions of people did not leave their home, apart from going out for the most important errands. And we had a surge as a result also of delivery services. So those delivery service drivers, and that the number of those increased. They became kind of heroes for in the Chinese societies. But due to these, well, the lockdown in March, very much of at a national scope, so to speak, production activities were interrupted, and supply chains also were interrupted. So even after the companies decided to produce, go back to production, and I can talk about that a bit more in detail. There were still a lot of things that didn't work immediately afterwards. Schools have been remained closed for most parts of China until summer, And they switched to online teaching, regardless of the fact that the lockdown was not a national one at the time. And so also did the universities. And some of the latter, the universities, restricted students to stay within the confines of their campuses even after the lockdown measures were eased for teachers and the rest of the cities. So we had some rather worrying accounts of students being kind of being prevented from leaving their campuses way until last summer. And that actually also led to a certain protest by students were obviously not happy with this, and also found that this was very unfair treatment because their teachers were allowed to leave the campus. Well, and then the fourth measure is what I would call kind of fortress or island China measures. And that is I mean, we had it in Germany, we occasionally have this discussion whether in Europe we could follow the example of Taiwan, South Korea, or Japan, or so on. And the argument that is often brought forward is, oh, well, these are islands, which is not true for South Korea, but you could argue that it is very close to, has a lot of island characteristics because of this impenetrable border with North Korea. But if that's true, then at least as one question about China, I would say, has tried to make itself into an island. Probably an island continent, it would be more adequate to frame it. China has a lot of borders with neighboring countries. Nevertheless, due to their very strict quarantine rules, but also the limitations of flights back in and out of China, they have, and also strict visa policies, they have been able to prevent people coming from abroad to China, and this includes not only foreigners. We often complain about the foreigners not being allowed to into China, which is still a problem today. But Chinese who live abroad and wanted to go home also faced severe restrictions last year. Again, first of all, the Chinese government limited the number of flights for each airline that were allowed to land in China. For Beijing, they even went further, because for whenever the situation became a bit, when they were nervous, Beijing it was not possible to fly directly to Beijing. And people who arrive in China have to go into quarantine, forced quarantine. If they are lucky, this is in hotels. If they are if on any of those flights there have been cases that tested positive upon arrival, they would more likely sent into isolation wards or hospitals with, well, depending on who you ask, not very nice conditions. And this is still going on. So, and in the most, unlucky cases of people from the outside flying into China, they had to first stay in quarantine, let's say at the point of their arrival. But if they then move to another province, they would have to stay in quarantine again for 2 weeks. If they were lucky, they could do that at home. Usually the quarantine in public places would, like hotels or quarantine isolation wards, would be followed by another period of isolation at home. Now, so the result is that we have very few people traveling to China. We have a lot of experts who are in China but do not dare to leave the country, because they are not sure, they would have to go through all this when they go back. Now, what is the economic and social impact of all this? The immediate economic impact has been felt mostly in February and March data of last year, mostly in February data. After that, China's economy slowly but surely emerged from the lockdown. It still faced problems, as I said, because some supply chains were interrupted, and it took some time to reestablish them. Some migrant workers were reluctant to return to the place of, to travel through China to return to their place of work. Other cities were reluctant to have the migrants coming back. So it took some time, but overall, production recovered faster than services related to tourism, to eating out, restaurants, and so on. They lasted longer because those activities were only allowed to recover, well, depending on where you are, sometimes in the middle of last year, sometimes at the end. In Beijing, restrictions were returned to become very severe at the beginning of this year because of those local clusters that had been identified. I hear, last week I heard it from people in Beijing said, well, things are have been becoming more normal again only about 2 months ago. In terms of enterprises, those because the service sector was so much more hurt than the production sector. On average, we can say that small and medium enterprises were hurt much more than big corporations. The unemployment numbers, at least for some time, rose considerably. Though this is only partly reflected in the official data, because the data only counts unemployment in cities, and in migrant workers are usually not included. And the social impact on schools, universities, and well, students and the teachers, well, let's leave the teachers out, but the students there is not really assessed so far, has not been really assessed so far. Personally, I think, and I said I'm reminded that I should come to an end. I think the geopolitical and geoeconomic impact of all this will be felt only over the next years. What I personally think is, and we know this, all those who usually intensively interact with China, is that we have, due to, well, the pandemic in China, but especially also to the never-ending pandemic in the other regions of the world, we have too little or hardly any opportunities to really openly discuss with Chinese, to interact casually, to go out eating, which is so important in China, or with Chinese to come to develop trust and an open atmosphere for discussions. That we do a lot of Zoom things and interactions. That's possible. The Chinese side is very interested in these, also my colleagues, but it is not the same, because everything that is digital can be supervised, whereas a private talk over a lunch cannot necessarily. And these the reduction of international contacts, the fact that a lot of expats and experts for that matter are either leaving China or have not been able to go back, or are not going there now because they could go maybe under these harsh conditions, but they could not bring their spouses, for example. So we have much less interaction, much less contacts with the Chinese side. And this, together with the overall, well, the background conflict between the US and China, and also with the political developments in China, is quite worrying, because I think we need more interaction, more dialogue in these times because of these other dynamics, but we have less because of the coronavirus. And this is where I think the challenges are for the future. I stop here. And I'm happy to answer all kinds of questions to things that I should have mentioned, but maybe did not.
Thank you very much, Doris, for this really, really interesting summary of the measures that China applied. So we see that they have a whole variety of measures that they combined: the early on wearing of masks, then the thorough testing, the trace isolate strategy, and also the use of apps, including the analysis of big data, and then in addition, closed borders. And in this way, China has avoided a second and a third wave, while we are currently, I think we are coming out of our third wave in Europe. I hope so, at least. What I would like to know, could Europe learn something from China, or would you say, since our different governmental systems, Europe should or cannot learn from a non-democratic country? What's your opinion on that?
Well, I think we could learn something, and these are two things. I mean, this is obviously more a personal opinion and maybe an expert opinion. One thing is, I think these, which I stressed at the beginning, the whole idea to live with the virus, so to speak, instead of trying to really get rid of it. That is a very important distinction between the approaches in Europe and in China. And this is not limited to China. This is also the approach, as I said, in Taiwan and South Korea, even in Australia and Japan. So we have decided for a different approach. And one reason is that it was always, we cannot close the borders. And well, the Chinese haven't closed the borders completely, nor have these other countries. They have imposed strict quarantine rules for all those who come in. And while I would fully agree that this is would have been difficult for Germany to do on its own, to do, for example, that we do it on its own, the question whether we could have and maybe still could think of a European approach in this direction it has always been on my mind. But we know how difficult it is to find a consensus for certain things at the European level, and Europe in this case is not in charge, so to speak, or has only limited competencies. So yeah, for the next pandemic, I hope that we think about what would be appropriate and whether we shouldn't think of this. I mean, we talk about Fortress Europe when it comes to migrants and refugees, but we pretend that we could not turn Europe into an island for fighting the pandemic. So, I mean, this needs a democratic process probably, but so these are two things. And the third is that I mean, of course, probably China had also political motivations to say they have to have a war on the virus, but they also obviously followed the scientists in this. And I mean, this goes beyond a bit mere China expertise, but we have an attitude that we can negotiate what we do in order to fight the corona. And well, there are a lot of colleagues and among virologists and immunologists said, well, you can do a lot of things, but you cannot negotiate with a virus. Yeah, and at least not if it's a pandemic like virus.
Mm. So how was it in China? Did the Chinese people always trust and support the government in these measures, or do they have also some? I mean, here we have some people who believe in conspiracy theories, and who do not accept even what is a relatively light lockdown compared to what had been happening in Asia. So is this was that a problem in implementing all these measures?
Well, we have occasional reports that these community, well, fencing off communities, so to speak, and that there have been people who try to sneak out of it. So that is an indication that they have been not happy. They are also, we know from the severe lockdown in Wuhan that there have been people who have been very unhappy. I mean, there was this one incident where delegates from Beijing visited Wuhan, and then a whole gated community, they did a lot of noise on their balconies in order to show protest. I think at that time, the protest may have been, well, it's never so clear then, I mean, if you have these kind of movements, whether it's really against the lockdown or maybe rather against the government not being so open at the beginning, whether it was because of this fate of famous Dr. Li Wenliang, who, I mean, who tried to spread the news, was suppressed, and then later died from the coronavirus, and only then was kind of turned into a hero by the national government. So this is, but of course there are also people in China who are not happy. I mean, because there are people who are not rich, who are not white-collar workers, who are not, let's say, cadres, and who need a living, somehow have to go on with a living, or maybe also not so well-educated people. Now, there is also a resistance, but overall, and that is the interesting thing over time, I think, even though public polls in China or surveys are obviously not, we usually don't fully trust them, but I think a lot of people appreciate that the government has been able to suppress the virus after the first wave with I mean, they were not happy with the measures at the beginning, but now they see that in China they can move freely. They can even go on traveling now for the Golden Week over the 1st of May, whereas they hear from, I mean, Europe, where we have all these restrictions, which are restrictions that are not as severe as they may imagine, but also, and we should not underestimate whether this is due to let's say propaganda or whatever, but the fact that the German government, for example, just to pick out, allows over 80,000 people to die of this virus and somehow is able to live with it is not very well accepted in China. You could argue that, well, you know, there are so many people who die from other things all over, I mean, we know these discussions here, But in China, this idea that the government wanted to make sure that nobody is left behind and that everybody is rescued if possible, and that health, keeping them healthy is a very important target, is much appreciated, I think. Nevertheless, I mean, even today, I mean, I know from colleagues in China, everybody is unhappy with the fact that the students cannot travel. I mean, that foreign students cannot come in. That is the government. I'm not so sure, the central government, but our university colleagues always say we need this interaction. Chinese students can go out. They are not restricted from studying abroad, but many are also hesitant because they know once they have to go back. And first of all, it's costly. The flights are much more costly today than they used before the pandemic, because there is this artificial restriction or limitation of flight numbers. But also, I mean, going through these quarantine routines is not nice. It's not something that you like to do voluntarily. If you can avoid that, you don't do it. And so, yes, there is also discussion in China. There have also been discussions about these apps that some local governments want to have health codes or whatever for things where people obviously say, well, this is not necessary. Why do you care at this place? We have anecdotal evidence that the students have not been happy with being confined to their campuses for several months. This seems to be over. I'm not sure, it's some months ago that I talked to colleagues where they told me, well, when they have, even the colleagues, the professors, if they want to leave their city, they at least had to inform the governments. There have also been reports recently that Shanghai tries to impose new rules, how people have to register when they enter China. Shanghai, which is not 100% sure whether that's related to Corona or whether Corona is rather an excuse. And so, yeah, there are bits and bytes where you hear that people are not always happy, but overall they are thankful or grateful to the government that they don't have a second and third wave.
Mm. So was there ever, I mean, we in Germany, we have experience with public opinion. First, people rally behind the government, and then suddenly it drops, and that they don't esteem it as much. Was there ever a time in China when the pandemic threatened the power of the Communist Party?
If there had been, it was, no, I don't think so. If at all, it was at the very beginning in the situation in Wuhan. But I think it was that challenge was not real. But the government had the fear that if they can't contain this, if this is really spreading all over the country and really becoming a pandemic within China beyond, let's say, Wuhan and Hubei, then that would threaten their power. And there have been analysts in the US who very early on in January said, like, this is the Chernobyl moment of China. Probably, I mean, somehow Chernobyl, I mean, the Soviet Union did not this kind of December or so immediately after the Chernobyl incident, but there are people who would say, well, Chernobyl was somehow one of those crucial moments. This has not happened, and because the Chinese government was successful to contain the spread, I think they have more support today than they used to have. This is not a guarantee that if this island-like or fortress China approach lasts for, I don't know how long in the future, that people may not become more resistant to this. But currently there is not much of a resistance.
Mm. Okay, talking a bit about, since China has been quite successful, as we have established now, as containing the virus, they are now also giving their own vaccines to other countries, what is quite often termed as China's vaccine diplomacy. And many observers in Europe say that China with that wants to increase the dependency of other countries to it, while China itself says it is simply trying to help other developing countries who are otherwise unable to cope with the virus. How do you see that? What is your opinion on this?
Well, I think it's a bit of all of this, to be honest. First of all, I think that in the beginning, the government really hoped that due to China's experience, and I mean, they probably put pressure on the Chinese researchers to come out with a vaccine that is good for China, but also could kind of become good for the world and show how China has developed into a leading country in medical research and all these things. They started early on vaccination of soldiers and so on. That was probably mandatory because they needed test persons, so to speak. Yeah, and then I mean, if there is not a very high level of trust into Chinese medicine in China. Especially it's a Western modern medicine. But traditional Chinese medicine is a different issue. And so I guess they wanted to have these, they needed testing persons. And so they somehow forced some people made it a heroic action or something like that for soldiers and so. And then they there are several vaccines, have been several vaccines developed in China using a different technology than those that are most prominent in Europe, like BioNTech and Moderna. And so I think it's a bit tragic that that the efficacy or efficiency of those vaccines from China are said to be lower or have been proven to be lower than those originating from, let's say, BioNTech, Pfizer. And there's a second problem, and that is because China has been so successful in suppressing the virus, they don't have test persons. So going abroad initially and convincing some countries to use the Chinese vaccination was also necessary to have enough person to test it. I mean, you can only test whether the virus, there's a vaccine works if you are in an environment where there is still a virus somehow spreading, and China did not have these places. So I think that was also very important motivation. And yes, of course, if China can export now in larger quantities the Chinese vaccines and these prove to be helpful, of course I see it as a way of gaining international reputation and partners. The irony is that in China, the willingness to take part in vaccination is limited. First of all, because some people seem not to trust the Chinese vaccines too much. Second, because if you have no one in your environment who is, if the pandemic is not there, as in other countries, why would people dare to take a vaccination? And so what the Chinese has tried to do is, at least in some places, they try to create incentives for vaccination. There has been this joke that they offer a package of fresh eggs to peasants also to get vaccinated, and then others spread on WeChat. Well, there have been people who went now for vaccination every day in order to collect these eggs. Yeah, and so you create incentives, and then you don't know what people do just to get hold of those incentives. It's still in many areas a poor country. So I think it's everything. It's this idea of showing that China is technically advanced. It's also an act of solidarity in some cases. It is also a foreign policy idea. And there has been in between, at least last year, a period where they just desperately needed areas where they could test the vaccine, because you probably are all now half experts on how this works. So you have the first trial, the second trial, and there's a third trial stage. In the third trial stage, you need a larger amount of people. And in an environment where you can test whether it's really, you need a test group that is not vaccinated, you need a test group that is vaccinated, and then you have to see how this evolves. And that is only possible in an environment where there is a pandemic, so to speak, and not in China. You can't do that any longer in China.
Mm. Okay, I'm looking at the time. We are already over it, but I would like to use the academic 15 minutes also to ask one last question. Do you see any options for cooperation between Europe and China, especially when it comes to helping other countries overcome the virus?
Well, yes, I think as far as I know, this is partly underway because China has been part of COVAX. It's only the problem is that the Chinese vaccine for a long time was not internationally accepted. Second, there is a very practical cooperation because BioNTech Pfizer is actually producing in China, but only for Asia so far and not for China. This is, as far as I know, changing. The head of BioNTech, the German CEO, so to speak, or owner of the company, has been in China, stayed and went through this quarantine stay and so on. And there has been an agreement that sooner or later, BioNTech Pfizer should also be used in China. So, but with that, it also means that probably there is a support for the whole operations, or larger support for the operations in China, and that could be helpful for Asia because that's already a destination. And apart from that, as far as I know, and there is anyway at the level of scientists, there is a lot of cooperation going on. We should not underestimate that. There is a complaint that the Chinese have not shared all the data about the early origin of the virus in Wuhan and what all these things, and that is a crucial. That is if it is true, as far as I can say, it seems to be true because that comes from authoritative sources. And that seems to be very difficult for the research, because for the researchers it would be helpful to know where it originally comes from. But apart from that, as far as I know, the international cooperation in immunology and virology and so goes on and has always been there. So, and then, I mean, if the Chinese vaccine is accepted internationally eventually, which seems to be underway, more or less, not sure, not maybe for use in Europe, but at least by the WHO, then it could be used for COVID. Yeah, there could be a cooperation. Unfortunately, we have seen this also in last week. There is this whole idea of patent protection, I mean, which is a very difficult topic because you need patent protection in order to have these incentives for very innovative firms to go into these kind of things and to do research. On the other hand, you could argue that in the long run for these kind of pandemics, we need open access to the patents in order for others to be able to produce according to these, let's call it recipes. Again, I'm not a medical expert, and to advance a kind of large scale production. And I think that in this discussion, knowing that there's a global competition for also in medical research or in health industries, let's say that's probably more appropriate, there will always be this kind of, cooperation in basic research, but then probably competition and concerns about property rights when it comes to the large markets for certain medications.
Yeah, I think especially the mutual recognition of the vaccines is something that many people here in Europe, but also over there in China, are hoping for at the moment, to be able to travel back and forth and keep in touch better again, although we can do it obviously via virtual meetings. Unfortunately, we have not managed to answer all the questions that came in from the audience. I'm very sorry about that, but our time is up. However, I have other solutions for you in the audience. So first thing is that we will be sending out Professor Fischer's article very soon to you directly. And the other thing is that we have an email address under which you can contact us and stay in touch with us. Our email address is asia@hss.de. And if you write to us, you can also subscribe to all of our newsletters that are coming from the South and Southeast Asia division, as well as the Northeast and Central Asia division. I also want to give you the heads up, next week, Wednesday, the same time, we will have a look at Philippines' fight against COVID-19, and we will learn how the virus spread in the Philippines and which strategies were used to contain it and what are the social and political consequences there. With that, I would like to thank Professor Fischer for your fantastic input today. It was very interesting. I would also like to thank our organizational team behind the scenes. And last but definitely not least, I would like to thank everybody who signed up today and listened. Thank you very much for attending. When you sign out now, you will see a very short survey. Please fill it in and help us improve our seminars in the future. So thank you. Goodbye and see you next week for the Philippines.